I'm Alexandra Perry, the Chief Executive Officer of Rare Diseases International, the global alliance of persons living with rare diseases. The World Health Assembly resolution on rare diseases, adopted in May 2025 this year, is indeed a landmark. It's a milestone for the rare disease community because for the first time, rare diseases is recognized as a global public health priority. But most importantly, the resolution asked the World Health Organization to develop a global action plan on rare diseases. It will be a 10-year global action plan. And this will help countries all over the world to have a roadmap with some clear targets, indicators, and a monitoring process and accountability. So it will really help to see progress in the policy all across the world. And Egypt has initiated that resolution with Spain, and more than 40 co-sponsors or 40 member states has supported that resolution. In addition, RDI has set up a coalition of more than 300 organizations, including patient organizations, hospital, academics, to support the resolution adoption, but beyond, to also support the implementation of the resolution. Because we do not want that resolution to just stay a paper in Geneva. We want that resolution has an impact in hospitals, in families, in every country in the world. And I applaud the leadership of Egypt, the Minister of Health, Abdel Ghaffar, but also Professor Hassani for really leading the path globally, but nationally. I've been here for 3 days to this Congress, and I'm amazed to see all the investment in health, but also all the commitment, all the action that have being developed for rare diseases in Egypt. I think Egypt is really leading the path and can be an example for the other countries in the region. You know, for rare disease patients, the diagnosis odyssey, it's terrible because it can take between 6 to 7 years before receiving a diagnosis. And you can imagine for families and also adult patients, they are invisible, they are lost in the healthcare system with the disease. So increasing the capacity at country level for diagnosis, it's critical for patients, for rare disease community. And the strategy that Egypt is undertaking to invest in health infrastructure, but also to expand the newborn screening program and to invest in molecular testing and genomic testing, it's remarkable. And having that capacity here in the country can definitely also enable Egypt to become a regional hub. We know that in other countries in the region, notably North Africa, the advancement is less, and so Egypt could really play a role also to share knowledge and expertise for other countries in the North Africa, but also to perhaps receive some case to help for genomic testing. Thank you to HVD for inviting me to participate to the session on advancing diagnosis. But again, I'm very grateful of the Minister of Health of Egypt for leading the path for rare diseases. It's a real example. So I wish you the very best.